The patients that we see who have had a massive weight loss, either from their own hard work or with a little assistance from a procedure like a gastric bypass or a gastric sleeve, those patients tend to have loose skin almost head to toe. And they will have gone through this wonderful life-changing weight loss. They've gotten rid of high blood pressure, they don't have diabetes anymore, they're working out, and they still have this skin that's the reminder of what they had been through.
When you've lost 150 or 200 pounds, what happens is you lose the skin elasticity and it doesn't go back, and you're loose mostly everywhere. And so we do facelifts, arm lifts, breast lifts, tummy tucks or lower body lifts, thigh lifts. And the question always is, well, what do you want to do? And how much do you want to do? And what order do you want to do it in?
We will end up over several procedures to make sure that we can be the safest for them, operating in each of those areas that concern them.
And patients often inquire, what do the scars look like, or where will the scars be? And that's very individual. So if you've lost lots and lots of weight, we're talking a couple 100 pounds, and you have lots of extra skin underneath the arm, odds are you'll need a pretty long incision to remove the skin. If there's a little skin, it's a little scar. Sometimes it's a small scar that is just in the armpit area. So it really depends on the individual. But we're trying to put scars in places that are well hidden. If we're gonna do a thigh lift and we need someone's lost a lot of weight and they have a lot of extra skin, we wanna do that incision on the inside of the thigh. So if you wear a skirt, you can't see it. Now, if you wear short enough shorts, you'll still be able to see it, but the scar has to go somewhere. And so we can compromise as well. If someone is absolutely committed to not having a scar on their thigh, we can do a lesser surgery. We can remove less skin. Now, it comes with a little bit less result, but we can tailor that to what the patient wants.
So people often come in concerned about stretch marks, and with good reason. If you catch stretch marks early, sometimes we can laser them. If there's a color distinction, in other words, if they're still red, we can use a laser perhaps to help soften the distinction between the stretch mark and the surrounding skin. But once they've matured, once they've become actual stretch marks that look pale, kind of like the skin around them, the best option at that point is to really cut them out. And that's often done with a tummy tuck. Now, a tummy tuck's going to get rid of all of the stretch marks below the belly button, but sometimes people have stretch marks above it. And what's remarkable about a tummy tuck is, not only do we get rid of the ones below the belly button, but by pulling down and stretching the ones that are above the belly button, we make them look better. It's really kind of remarkable. They're brought lower and they seem to improve. So a tummy tuck is a wonderful procedure for stretch marks.
Often patients want to know whether we do liposuction at the time of weight loss surgery, and will that help them lose more weight? The short answer is yes. The long answer is it depends on where the fat is. If there's just a problem area, and lots of people have problem areas, even people that have lost lots of weight, there's just some areas they can't get rid of the fat. And in that problem area, we can do some liposuction and we can remove the fat from that one area, and then also maybe remove some skin, because usually weight loss patients are coming in because of extra skin. But if there's extra fat deposits there at the same time, yes, we remove that. And will you weigh less afterward? Yes, you will, because we'll be removing that fat deposit from that area and it won't ever come back there.
So we do a lot of body contouring. It's one of those things where patients afterwards are incredibly grateful. They've worked hard to lose all that weight, and now this is sort of the icing on the cake. You know, it's important.